Well, AI has been the biggest theme at this week's JPMorgan Healthcare Conference here in San Francisco, but we've also been hearing a lot about China, federal collaboration, and doing more with less. Welcome to CareTalk, America's home for incisive debate about healthcare business and policy. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the chairman of UConn Health.
Well, this is a very special episode coming from JPM. We've been immersed this week in presentations and meetings that will set the agenda for this year. And John, you and I are right next to each other too, which is
too many presentations and meetings, David. We just thought it was important for our community to hear the hot takes from JPMorgan. We'll have a more reflective episode, hopefully in a week or so. But David, what are the headlines for you from JPMorgan?
You know, I thought it was going to be all about AI, and there is a lot about AI, but someone came up to me and said, well, all I've been being asked about is about China and about federal policy.
Maybe it's the wrong person. Maybe he was at the wrong conference. We are in San Francisco.
He was. There were some other oddities here, but no, I'm seeing. I still see AI as the main thing that's being talked about, but there's a bunch of other stuff too, and a generally positive mood overall.
JPMorgan is the annual conference that the mega bank JPMorgan holds in San Francisco, which brings together the industry from all levels, from early stage startups to Chinese companies to nonprofit hospitals. It really brings together the industry in many ways, the for-profits and the not-for-profits, docs, hospitals, AI companies. I think to your point about AI being a theme here, yes, we're in San Francisco where AI seems to be in the water, but at a healthcare conference, you had NVIDIA, the chip manufacturer, in this particular hotel. Microsoft, the next day in this hotel. OpenAI had a big presentation on chat with about one of the leaders of Nick Gross from who talked about how healthcare and ChatGPT and OpenAI. Anthropic had a big announcement that seemed to affect the stock that I'm most familiar with, Waystar, where I'm chairman. So AI is definitely part of this, but because this is really a conference that touches the $5 trillion market we play in, I don't think it stops there. At least for me, the big takeaway was the federal government leaning in a big way to say we want to partner with the private and the nonprofit sector to reform healthcare. There was a really interesting presentation on Monday night, coordinated by John Doerr and former CMS Administrator Andy Slavitt, with CMS Administrator, the famed Mehmet Oz, who brought his entire team, the head of Medicare, Chris Klump, the head of Medicaid, Dan Brillman, a lot of folks who come from the private sector and their teams to literally talk to some of the larger nonprofits, the faster growing for-profits, about how they can partner to make the government a better partner, because government still pays 52 cents out of every healthcare dollar. So for me, that was the headline news. And whether it's the replatforming of the entire Medicare database, which could make data more interoperable and accessible, for Medicare or Medicaid, Dan Brillman talking about how they're going to remove the bureaucratic layers that made it hard for people to stay on Medicaid, or Mehmet Oz talking about how it's just so much more important to do more with less, but he's going to partner, CMS wants to partner with docs to make it easier to get there. I thought that, to me, broke through in a novel way. What else was a novel hot take for you during this conference?
One of the things I like is a chance to catch up with some former colleagues. I used to work at Boston Consulting Group way back when, and I went to an event. They had actually, they asked me to do a bit of a video on my view on AI.
Do they still like you?
It's everything's relative. They had to fill up a certain amount of content, but we'll link to that one in the clips and let people in the comments people make their own assessments. They did a really good panel with the head of healthcare for AWS. They had somebody from a hospital. And the one that I thought was the most impressive, though, was from Hippocratic AI, the CEO there, Munjal Shah.
He was everywhere. Well, that's probably going to be one of his challenges.
That could be. There are a couple of things that he said in particular that I thought were good. So one is panelists were asked about, is AI going to take jobs? Mm-hmm. And they said, look, in healthcare and education are two places where we can deal with that abundance. And in fact, the right ratio of...
By getting rid of jobs?
The right ratio of, a physician to patient is 1-to-1 and teacher to student is 1-to-1. And that we really shouldn't be worried about job loss because it's going to provide opportunities to do all sorts of new things that we wouldn't.
Well, particularly for Munjal, not for the people who are losing their jobs. But to be fair, we're about a couple of 100,000 clinicians short in a couple of years. but Munjal and Hippocratic was showing up everywhere. But don't you think, Dave, that some people do run the risk of losing their jobs with this AI wave coming?
There may be. I mean, his point was that's always been the case. We've been concerned about job loss, but the focus was more about what are the new things you could do. So on the pharma side, it was something as mundane as, well, only 20% of drugs are actually promoted. You can't afford sales reps for them.
What we need is more drug promotion, more of those fun dancing people on TV, and then talking about horrible conditions.
Exactly. And then for recruitment for clinical trials, he mentioned that the AI could learn all of the inclusion and exclusion criteria for trials. So when it's speaking with somebody, it can actually learn about whether they might be qualified by asking things that aren't in the EMR, like, do you get a rash from wearing your continuous glucose monitor?
So the EMR being the electronic medical record, which is really effectively the when the doctor's not looking at you and they're or the nurse or the PA tech, they're typing things in. That's the electronic medical record that really effectively gets in the way of all workflow. If you could build some intelligence in there, that'd be interesting. The interesting thing on job loss and job creation is what I heard over the week in a number of different healthcare presentations is the biggest job loss is actually in the IT area, where there's a 40% improvement in coding and coding production. And what the folks who are trying to engineer healthcare IT leveraging AI are trying to make the employees they have more effective and more efficient. So actually, I think it might allow us to get more leverage from clinicians. But it felt like the AI conversation is the promise of AI outside of healthcare, outside of technical coding, software building, is a little bit overrun. Why do you think people are more optimistic this year, David? Because I definitely was a feeling of optimism around investment, growth, and healthcare in general.
I think that there's a sense of some stability or new normal. The drug industry, in particular, pharma, has sort of made peace with the administration, and they're not worried that they're going to be, put out of business. I think they found
it's kind of like NATO, and they've sort of made their peace. Europe and the Ukraine, they're.
I don't know if it's like that or not, but there's a sense of, okay, there's a stability, and then you can invest and you sort of understand where the rules are. I think actually,
and just to your point, one of the things that Medicare pointed out, that Chris Klom pointed out, they've cut like 15 or 16 deals with the 15 or 16 top people from pharma. I mean, it's really remarkable how effectively that the Trump administration has both pressure and collaborated to create solutions. It's really amazing.
So, John, it's been actually a couple of years since I've been to San Francisco. And in fact, when I was looking to come to the conference a couple of years ago to see if it made sense, actually what a lot of people were telling me is like San Francisco itself is dangerous and you may want to stay away. I just want to say it's been quite a positive experience.
So the administration is no longer dangerous for healthcare. AI is the friend of healthcare, and San Francisco is open for business. Is that the hot take?
Well, let's talk about, yes. I'll just going to vouch for the third one. And there's a couple of interesting things. I actually took my first Waymo trip this morning.
Do you want to explain what a Waymo trip is? It sounds like you're taking transit to some kind of drugs.
Well, that was a bonus that we're not for consumption here, but we'll talk about that in a second. So Waymo, when you walk around San Francisco, you see all of these actually Jaguar SUVs with a bunch of kind of space age sensors and things spinning around, and it's driverless vehicles. And a couple of people encouraged me to try it, so I took one this morning. You summon it like an Uber, and it moves along. Drives a little bit differently, which they warn you about, but it's very smooth. It's a good experience.
I agree with you. The Waymos it feels a little bit like Lost in Space or Star Trek for folks from our generation, but there's no driver. It's all automated. It's all app driven, but the cars are clean. They're effective. They come quickly, and the pricing's pretty good. I think that from an artificial intelligence perspective, that may be the most impressive demo we saw this week in San Francisco.
So we've talked a lot, John, about kind of, substance abuse and deaths of despair and so on. And the truth is, in San Francisco, right near where you've got these very expensive hotels and boutiques and so on, you see a lot of this despair. Now, in previous years, during the meth crisis, you'd see people that were actually psychotic and like activated. I don't know what they were seeing, but there's a lot of screaming,
wasn't what we saw.
And so on. No. And this time I saw something very odd, and I posted about this on LinkedIn, which was I was walking along pretty early in the morning, maybe through a neighborhood I shouldn't have been, and I saw 3 or 4 people kind of like bent over, like that. And I thought, this is the start of some sort of like street performance, like a dance or something. And then I saw a number of others, and I looked it up, and it's called the Fenty Fold or fentanyl fold, and people are just sort of like stuck in place. It's terrible.
It's really sad. And I think although San Francisco's made an enormous amount of progress under the new mayor, Dan Lurie, they still got some work to do. And I met the former Biden guy who's working with the mayor on this, and I do think they've got some great plans on this. But San Francisco is much safer than it was, but they've still got some real street challenges that they need to figure out. So, Dave, I think maybe we leave it there and dig a little deeper into the presentations from this week, and we will have more for our CareTalk community next week.
Great. Well, that's it for this special JPM edition of CareTalk, straight from San Francisco. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the chairman of the UConn Health System. If you liked what you heard or you didn't, we'd love you to subscribe on your favorite service. And we'll talk to you next week.
Take care now.